On this video, we are going to look at some basic medical abbreviation. Starting with the first one, we have ECG. In this case, you can also call it EKG. What is ECG? This simply means electrocardiogram. Let's put it down. Electrocardiogram. So, electrocardiogram is simply a diagnostic test that records the heart's electrical activity by attaching electrode to the skin. And this is how it looks. Let's see, this moves up. I'm just giving a random drawing to it, and let's see how it's going to be. So, in this case, on the waves, we have the Q, R, and S. Two of these waves are for contraction, and one is for relaxation. Next thing we have on the list, in the case of abbreviation, we have the BP. This simply means blood pressure. Now, let's look at blood pressure. Blood pressure is the measure of the force of blood against the wall of the arteries as the heart pumps it around the body. It's commonly expressed as two values. We have the systolic pressure and we have the diastolic pressure. The next thing we have on the list, we have the USG. So, in this case, USG simply means ultrasound sonography. Ultrasound sonography. What is ultrasound sonography? This is simply the diagnostic imaging technique that uses high-frequency sound wave to create real-time image of the inside of the body. Let's take an example with pregnant woman. How does the USG works? Let's assume this is the display screen. This is how it looks. So what do we have next? Next thing we have on the list, let's say number 4. Here we have OD. Basically, you can find this on the prescription. OD simply means one daily. Let's take an example of drugs which can be taken one daily. We have TAPS, albendazole. Each tablet contains 400 milligrams. Let's say OD multiplied by 3/7. Another example of drugs which can be taken OD, which is one daily, we have the TAPS L-Flox, which is a short form of levofloxacin. Each tablet here contains 500 milligrams. This particular drug can also be taken OD multiplied by, let's say, 10/7. But remember, this 500 milligram is adult dosage. If you said 500 divided by 2, this is simply going to be 250 milligram. This is the children dosage. So, number 5, the next abbreviation we have the QID. This simply means 4 times a day. So now, what medication can you take 4 times a day? Let's take an example with CAPS. So, CAPS amoxicillin. Each tablet contains 500 milligrams, usually taken QID multiplied by, let's say, 1/52. In this case, the 1/52 simply means we have 52 weeks in a year. The QID simply means 4 times a day. 500, that is the milligram, and this is the drug name, and this is how it comes. It comes in form of capsule. Next thing we have on the list, we have the TDS. In this case, TDS simply means 3 times daily. What medication can you take 3 times a day? Let's take an example with TAPS PCM. In this case, this is NSAID drug, which is non-steroidal anti-inflammatory drugs. This is a short form of paracetamol. Each tablet contains 500 milligram. 500 multiplied by 2, this is simply going to be 1000. Milligram to gram, 1000 milligram is equivalent to 1 gram. That is for full adult dosage. Therefore, PCM is simply going to be 1 gram TDS multiplied by 3/7. Let's take an example with next example with TAPS augmentin. In this case, this is a combination of amoxicillin 500 milligram and clavulanic acid 125 milligram. 500 plus 125 milligram, this is simply going to be 625 milligram. Therefore, the milligram is going to be 625 milligram. In most cases, this particular drug is also taking BD multiplied by, let's say, 5/7. Number 7. What about BD? Sorry, this is TDS. Oh, sorry. Okay, sorry. What about BD? This simply means 2 times daily. Example of drugs, though, in this case, augmentin 625 milligram is also BD. But let's see another example of drug which can be taken BD. On the prescription slip, this is how it looks. We can also have TAPS, let's say, ciprofloxacin. Each tablet is 500 milligram, that is for adult dosage. For children, in some cases, 500 divided by 2, this is simply going to be 250 milligram. But here we are dealing with the case of adult. This is tablet ciprofloxacin 500 milligram, let's say BD multiplied by 5/7. We can also have some analgesic, let's say TAPS diclofenac. We have the 50 milligram and we also have the 100 milligram. So depending on which one the doctor suggests, this can also be taken BD multiplied by, let's say, 5/7. So what about, next thing we have on the list, we have, as number 8, we have the PC, which is also abbreviation. In medical context, PC simply stands for after meal. Example of drugs, okay, let's put it down, let's say after meal. Example of drugs which can be taken after meal, we have the non-steroidal anti-inflammatory drugs, which is NSAID. We have the diclofenac, we have the ibuprofen, and we have the dexamethasone. These are a few examples of NSAID drugs. So next thing we have on the list, we have the BBF. I think that's number 9. We have the BBF. This simply means after breakfast. In this case, some antibiotic can be taken with or without food. Let's take an example with ampicillin. Let's say CAPS ampicillin. And we have TAPS albendazole. albendazole. So, but in most cases, tablet albendazole are taken before breakfast. So, next thing we have on the list, we have the IPD, which is number 10. That is the abbreviation. We have the IPD. This simply stands for inpatient department or inpatient unit. This is simply a section or area of a hospital or medical facility where patients are admitted for overnight stay or extended period receiving medical care that requires them to stay in the hospital. Therefore, IPD simply means inpatient department. So this is it for this video. Thank you for watching. On this video,